So about a decade and a half ago, my journey towards trying to help people access dental care truly started, even though I had been working in dental public health for probably 3 decades by then. Maya was a little 4-year-old girl, and she came to us through a basic screening program, and we could see that she had 20 decayed teeth. 6 of them were abscessed. Basically, every single tooth in her head was decayed to the point of severe pain and infection, but she was so sick that we couldn't really treat her behavior in the dental clinic, so we referred her. So she would be able to have her dental treatment done under general anesthetic. Close to the time that she was booked for her treatment, the dad called us and said, well, we can't pay for this. Maya can't have this treatment done, we can't pay for it. So our office admin person went way and above duty to call all the relatives of Mia to see if somebody could cover this cost. Well, yes, an uncle could. Mia's all set to have her general anesthetic and have all of her teeth treated. And the day of the surgery came, and Mia didn't show up. Well, Mia was actually so sick from her dental disease that she had been hospitalized. She's 4 years old, she weighs 25 pounds. She can't eat, she can't sleep, she can't focus, she can't really think about anything other than the pain in her mouth. And she was on IV for several days, feeding her system. So she was well enough finally to leave the hospital. And so her appointment comes again. Day before her appointment, Dad calls. Uncle will no longer cover this treatment. And Mia is in very sad shape. You can die from your oral health. And children have died and adults have died. You can have a tooth that's so infected that the infection goes to your brain and it can kill you. On that day, I had a decision to make. I could choose to cover Mia's dental treatment and pay for it and have her go on to have a good quality of life, or I could let her suffer and lose more weight and probably eventually wither away. This little girl is not going to die on my watch. She had the treatment, and within a week we did follow up. Well, amazingly, shockingly, she's just like Mia used to be when she was 3 and her teeth weren't so badly decayed. She was happy, she was smiling, she was eating, she was running around and playing, and she was happy. And she went back to being just a normal little girl and went on to grow up and, you know, have a healthy life and a healthy mouth. And I call it Maya's story because it's based on her decades ago when we tried to help her. And that set us on a path to do this ongoing. So the need in Saskatchewan for us to be able to fund something like this is quite significant. And so whatever help the coalition can provide to people who need it, we need to do that. It's very important.